Hi everyone, welcome back. So today I'm going to be talking about something that maybe isn't quite as common as a lot of the other injuries that I post about, but still thought it was worth a post. So I'm going to be talking about the chest muscles and sort of sports injuries that happen involving the chest muscles. So, sports-related injuries in the chest area are, they're fairly uncommon. But it's important to keep in mind that life-threatening situations can occur due to high-impact collisions with another player, maybe in something like rugby or football, or, collisions with an object, either stationary or moving. Usually, these type of injuries tend to be due to a blunt trauma rather than a penetrating injury. Now, the mechanism of injury, as always, should always be considered on assessment, and any symptoms, obviously should be monitored. A pulled chest muscle, for example, can feel very similar to some medical issues involving the heart and lungs. So if there are any symptoms such as dyspnea, which is difficulty breathing, shock, hemoptysis, which is coughing up blood, irregular pulse, reduced breath sounds, distended neck veins, or tracheal deviation, it is really important that these symptoms are monitored, and just kept an eye on. But certainly if any of the following symptoms apply, then you really need to see a doctor, because it could be something a little bit more urgent. So if there's fast or laboured breathing, any kind of pain that gets worse with time and doesn't respond to pain medication, difficulty moving, if there is severe pain or numbness that lasts more than an hour, and also if there is general weakness and fatigue, or any redness or inflammation of the affected area, and also if there's a popping sound when the injury occurs. If any of these symptoms are present, then you should go and see a doctor and just get it checked out. Now, okay, in terms of sports injuries to the chest muscles, so the most common chest injury is a muscle strain, which would be due to overstretching or tearing of part or all of the muscle, which will cause sudden sharp pain. Usually this would be a pretty minor injury, and healing would occur days, weeks at the most. Now, if we look at the intercostal muscles, so that's these kind of spare ribs. They're the muscles that sit between the ribs. Those are your intercostals. Those muscles are the ones that are most commonly affected, in terms of sports injuries. They stabilise the rib cage and also assist with breathing. So you can see how, if you had sort of a collision, maybe in a rugby game, you can see how that's quite a sensitive area anyway. But also in terms of, breathing issues afterwards, you can see why it's important, to monitor. So in terms of causes, I mean, we've mentioned contact injuries. Any sports injuries from sort of overstretching, muscle fatigue, or any repetitive forceful movements. But also, occupational type injuries. If you're in a job that involves a lot of heavy lifting, that can also sort of increase the risk of injury to those intercostal muscles. Obviously, if you generally have poor flexibility, or you don't do a sufficient warm-up before, particularly doing gym-based exercises where you're doing a lot of weights. If anything where you are twisting the torso beyond its normal range, or reaching up overhead for extended periods, which again, could apply to certain occupations. Basically any overuse of the muscle. But also, the usual chronic poor posture is always going to play a part. But also any, maybe falls. Again, it's sort of another type of collision. And also, obviously, you'll know if you've ever had a rib injury, severe persistent coughing can also, cause some muscle strain in this area. Now, in terms of symptoms, we've kind of covered a few already, but certainly things that will indicate that some sort of muscle strain or injury are things like increased pain with movement of the chest or the upper spine, any pain that gets worse with deep breathing, coughing, sneezing, any tenderness around the chest wall, and also upper back pain, because what happens is when you have a chest injury, your back muscles are going to start to compensate. And you kind of see this with sort of, when you see those guys that go down the gym and they're so kind of focused on having like big pecs, that they actually kind of forget their back muscles bit. And they're walking around and their shoulders come forward, very rounded shoulders, and that's because they're overworking those pec muscles, which are shortening and tightening and getting really tight, and then your back muscles are overcompensating and weakening where they're kind of becoming so stretched. And so it can be a similar thing if you get like some sort of injury to those chest muscles. So if you've seen some of my other videos on muscle strains, you'll know that muscle strains are graded according to severity. So you've got grade 1, 2 and 3. Grade 1 is really your mild sort of damage. Less than 5% of the muscle fibres are actually damaged. Minimal loss of strength and movement, and usually you'd recover from a grade 1 muscle strain 2 to 3 weeks, sometimes a bit sooner. Grade 2 would be moderate damage. So this is where more of those individual muscle fibres are damaged, and the muscle as a whole is partially torn. This will result in significant loss of strength and movement. It is going to be painful and may take 2 to 3 months to heal fully. And certainly if you're talking about the the pec major, which I'm going to come on to, that's a big muscle, so that's going to take some time to heal. And then complete tear of the muscle, we're talking a grade 3 muscle strain. Sometimes it may even require surgery to reattach the damaged muscle. And I'm going to show you an example of that a little bit later. So looking at treatments, if we have a muscle strain to one of these chest muscles, obviously treatment will depend on the severity or grade of the injury, and will involve a combination of the following. So obviously we've got our usual sports injury treatment, which is the RICE principle, and that should be used for 24 to 48 hours following injury. So when you're in that inflammatory, stage. So we're talking rest, avoiding any strenuous activity to help aid recovery, avoiding those activities such as twisting of the torso and the upper back and overhead lifting, that are going to put extra strain on those chest muscles. Ice packs, applying ice to the affected area for up to 20 minutes, several times a day will just help take any inflammation down, which is also consequently then going to, help with pain levels. Compression. You may, want to wrap a compression bandage around the affected area. Not so common with the torso, but, the option is there. And then the E stands for elevation. A bit more difficult with the chest than it is, if you'd injured your leg. But just sitting upright, use extra pillows for support, and when sleeping, just to keep the chest elevated. So pretty straightforward, really. And then obviously, if you need it, painkillers, anti-inflammatories, things like ibuprofen. Just be aware of, if you're asthmatic or if you've got any gastric issues, sometimes cardiac issues, you have to be careful with ibuprofen, but there are other options. In more severe cases, you can, get some muscle relaxants prescribed by your GP. If it's at the point where if maybe you've had an injury due to a persistent cough, then obviously cough medicine. And, as we've said, if it's a grade 3 muscle strain where the muscle is completely ruptured, you may be looking at surgery to reattach the muscle. Okay, so spoken a little bit about those intercostal muscles. I am now going to talk about the one that we all know, which is that pec major muscle, which is quite a broad muscle. So that's coming, attaches up at the upper arm, and it just comes right across the chest area there. And that's the one that everyone thinks about when they're down the gym lifting weights. Basically the functions of this muscle, it, as I say, attaches at the top of the arm. So it's responsible for rotating the arm inwards, and you can see that on me, you can see that muscle moving. It helps to pull the arm across the body, which is known as adduction. And also pulls the arm downwards. So if you're lifting over your head and then you want to, pull that arm down, that pec muscle is doing a lot of the work, and sort of bringing that arm, and shoulder from flexion into extension. It's also responsible for adducting the arm, so pulling the arm up out to the side. You're going to get, this muscle is going to be doing some of the work, obviously the deltoids as well in the shoulder, but certainly that will, be sort of working the pec as well. Now, the tendon attachment, where it attaches at the upper arm, is actually quite a weak spot. And this area here where the pec major attaches is certainly prone to muscle strains, causing pain and inflammation around the front of the shoulder, sometimes with a visible, change of appearance. And certainly I, notice with a lot of my clients that come in saying they've got a bit of pain in their shoulder, quite often you'll hit trigger points for that pec major muscle, and, they can really feel it. It's really quite sore. So, yeah, certainly that's something to, look out for. Now, Pec major strain, as I say, is certainly more common in those that are weightlifting and down the gym every day, especially when they're doing things like a bench press. And certainly, you know, if you are one of these people, look back through my videos, because I actually did a few videos on good technique, and bench press was one of the you know, one of the sort of topics that I addressed. If you look on my channel, there's actually in one of the sort of albums, there's one called Gains Without Pains, and it's in that series of videos. Now, so in terms of symptoms with a pectoral strain, we're looking at sudden sharp pain at the front of that upper arm and sort of near the shoulder, rapid swelling of the front of the shoulder and the upper arm, because remember, this is a big muscle that spreads right the way across. Pain will certainly get worse when the arm is pulled across the front of the chest and you're really working that muscle, or rotate it inwards against resistance. You're certainly gonna, you know, if you've strained that muscle, you're gonna feel it. Now, it may even be completely obvious, and here we're talking about a grade 3 muscle strain. You are going to know quite often, because if there's a complete rupture, you're actually probably going to see a visible gap in the muscle, or possibly a lump in the muscle where the muscle has ruptured and it kind of bunches up, and the quads and hamstrings are known for doing this, but also the pec major can happen, and you can see this visible change in appearance. In terms of treatment for a pectoral strain, you know, it's really the same as with intercostal strains. Again, you rest, ice, compression, elevation for 48 hours following injury. Ice you can apply 10 to 15 minutes every hour initially, but then decreasing as your symptoms and pain reduce. A grade 3 tear of the tendon here is probably going to require surgery, you know, to reattach it so that you can get, you know, good functioning back. After a rest period, once the inflammation has subsided and pain is manageable, then you can look at having a sports massage to just help reduce any tightness, and just restore flexibility and functioning. And obviously also to help reduce any compensatory muscle dysfunction, you know, in the back muscles, and certainly around that shoulder, even in the upper arm. Now, there are a couple of basic stretches I'm going to show you. These are for the pectoralis major. These can either be used as a preventive measure or to rebuild strength and flexibility following that acute inflammatory stage, you know, when you've had an injury. So the first one is the sort of behind the head stretch. And this can also be good for people that work at a desk as well. But this stretch will work the pectoralis major and also the minor that sits just behind it. So you can do this standing or sitting, feet close together, arms bent so that your palms are resting against the back of your head. And in a slow, controlled motion, you're going to push your elbows back as far as you can until you feel a light tension around the front of that shoulder and into the chest on both sides. And you're going to hold it, you know, for a few seconds, and then return to your starting position and, you know, repeat a few times. Now, the other one is a doorway stretch. So I will show you. It's not the best picture in the world, but I will just show you to demonstrate. So for this doorway stretch, you're going to stand in a doorway with the forearm of the side that you want to stretch, resting against the side of the door frame. Other arm straight down at the side. Now, while maintaining contact, to the side of the doorway with your arm, you're going to gently turn your body away in the opposite direction, away from this arm, and just turn your head away as well, but also while pushing forward slightly. And you're going to feel again a good stretch from the front of the shoulder into the chest, into that pectoral muscle. Now, obviously, you want to work, the side that is strained, but, if using as a preventive measure, you can repeat on the other side as well. Okay, so that's really all for chest muscle injuries, but hopefully it's just given you a basic sort of idea of what to look out for, what causes them and how you can prevent them. But I will be doing quite a few more posts on various sports injuries and muscle groups, so do subscribe and you'll be notified when they come out. But otherwise, any questions, feel free to comment down below, or you can message me through my Facebook or Instagram, which I think the links are down below, and I will come back to you. But yeah, for now, that's really all from me, so I will see you next time. Take care. Bye.